Welcome to Stanford University and our inaugural Women Leaders in Global Health. I'd like to extend a special welcome to all those overseas at their homes and in their offices watching this live stream. Before I start this conference, I would like to reflect upon the fact that even in the wealthiest of infrastructures, we're still vulnerable to the ramifications of climate change. And I'd like to extend a heartfelt, our heart going out to our neighbors and first responders that are responding to the ravages of wildfires in Napa and Sonoma. So I had to start with that. Let's see. Whoops, I don't want to fall off this stool. This is not good. Okay. First slide. 6 weeks ago, Jim Young Kim, president of the World Bank, tweeted this photo after a meeting with top leaders from the World Health Organization. And how many of you have seen this photo? This is basically, for those of you not in the US, a room full of men discussing women's health. So where are the women? Where are the women in these pictures? Well, in fact, you are here. In fact, women are everywhere in global health. 90% of our healthcare, this is not moving forward, George. Next slide. In fact, 90% of healthcare happens at the home, and caregivers are overwhelmingly women. The Academy of Global Health, as you all know, is becoming increasingly feminized. I would say at least 85% of my students are women, and when you look in the literature that Jennifer Downs has done, there's been wonderful data on that 80% of global and public health students are women. We all know that on the front line in the community, with community healthcare workers, that at least 75% of the health workforce are female. And looking around the room, and this is an amazing room of women, there is no shortage of talented women in the pipeline. So, but the picture looks different at the top. With every step up the ladder, the proportion of women shrinks. The World Health Assembly is 68% men. 70% of health ministers, Patty Garcia and Agnes, are men, since we have many ministers of health of women in the audience. And on the front, and at least at US medical schools and public health schools and global health institutes, men predominantly hold the top positions, despite the fact that global health has become increasingly feminized. In Fortune 500 countries around the world, 26 out of 27 health sector CEOs are men. How can we succeed? How can we succeed when half of the talent sits on the bench? Well, we all know that diversity wins. When we have diversity, careers flourish, companies prosper, outcomes improve. And there's been some wonderful work done at our Clayman Institute of Gender Research, which actually shows this is true. So that photo I showed you of Jim Kim was retweeted hundreds of times. And the Women in Global Health, an NGO, one of our implementing partners, advocated for change in WHO leadership. So I want to give credit where credit is due. And this is not working, so I love it, Silicon Valley. Next slide. Next slide. I'm just going to ask you to do next slides. So basically, I wanted to show you and give credit to Tedros, the new leader of WHO, who last week announced his new senior leadership, of which 7 of 11 are women. And actually, a few of them are in this room, so I hope they share their story. Next slide. Well, actually, stay on this slide. I wanted to share, before I go on, one personal story. And that's the idea of this conference actually began when I was in Nairobi along with Wafa Satter at a MEPI-NEPI meeting, and we sat next to each other and watched and noticed that instead of, it was a conference to say, where is Africa going? How is it going to lead the next part of the future? And on the podium, instead of all white men, were all black men, and Francis Collins. And so when I got up and made a comment about it behooves you to think about who's on your podium when you go into the future, I actually got a standing ovation from my African colleagues that are women in the audience. So I went up to Francis Collins. I just want to tell you where this conference came from. And I said to Francis, you know, we need to do something about it. And he said, okay, I'll give you some money. And thank you, Hannah Valentine, for expediting that. If you pull together some mechanism where we can make a difference. So I am really hoping that this conference makes a difference. What I did, and I said, well, how am I ever going to put this conference together? But what I did was I pulled out, and I'm really old, I pulled out my Rolodex, and I went to some of my most amazing women friends and put together a steering committee. Can I have the next slide? And this is the names of the almost 60 people. Now, you may think, how did you do a phone call with 60 people? I want to tell you, we had the most efficient phone calls you've ever heard. We had amazing women on this call, and I want to thank the women in the steering committee, because really this conference is all about them. And the next slide, I want to thank, because it does take a bit of money to be able, what I really wanted to do is bring in emerging leaders, particularly from around the world who couldn't afford to come to Stanford. We really wanted to get financial aid, so we really had to raise quite a bit of money to fly people here and house them. So I want to thank my sponsors, because we were able to bring almost 70 women from around the world and give them full financial aid. So thank you, sponsors. When the conference was announced, we had no idea what the response would be. In short, it's been, may I have the next slide? It's been overwhelming. We actually have 390 women leaders in this room, 20 very brave, very lucky men. And I want to talk about how we engage men. We're going to have a panel on that because we're going to get nothing done if we don't engage men in this dialogue. 68 countries are represented, and 250 institutions, companies, and nonprofits. And even more men and women are joining by live stream. Our main objection, and I have the next slide, is to create dialogue and identify actions we can take, and really to discuss what the barriers are to leadership. Why are we not getting to those top places? What are we doing wrong? And who needs to engage to make a difference? And who can really lead to real change? And I must say, we have a hidden objective, which I hope you all take advantage of, and that's to create a community, to create an atmosphere for networking. So please talk to your partners. It's not only about finding a mentor, it's also about finding women who will sponsor you in your career and put you up. Lastly, my sincere hope is that this conference, however great it is, and I really hope it's going to be great, is not a one-off, that we actually end the day with tangible actions to go forth. And I really would love to see a sustainable movement for women in leadership in global health that goes forward. So let's start. I have a great video to start us off and kind of inspire us.